Good morning and welcome to another Medical Minute with the Colorado Springs Orthopaedic Group. Right now I'm joined by Dr. Paul Stanton, a orthopedic spine surgeon. Thank you so much for joining us.
Thank you for having me.
And we're talking minimally invasive surgery today, specifically anterior posterior lumbar fusions. Can you tell us a little bit about what that is?
So spine surgery can be done in many different ways. Sometimes we go through the back, sometimes through the side, sometimes through the front. The idea of an anterior posterior surgery is to get the maximal amount of spine correction with the least amount of invasive surgery.
Okay, and so for those who may not know, can we talk a little bit about what minimally invasive surgery is?
Minimally invasive surgery is the concept of doing less damage to the muscles around the spine as you reconstruct or repair any damage that's been done.
Okay, and what type of injuries would you recommend for an anterior and posterior?
It can be used for many things, typically spinal instability, spinal deformity, collapse, fractures or trauma, so there's a lot of good reasons that can be helpful.
Okay, and what is the, average recovery or rehabilitation time for this type of surgery?
Lumbar reconstructions using this technique usually take a few months of recovery, but one of the nice things is patients are up and walking on the day of surgery, so we're not parking them in bed for any length of time that can cause problems after a surgery.
Wow. And what is the average, I know you said that you get them up walking and up and about, but what is the average hospital stay after this procedure?
It could be 1 to 2 nights, so pretty quick compared to older spine surgery where you might be in the hospital for 5, 7, 10 days. Mm-hmm. We like to get patients up and moving and they can head out to home or rehab after a day or two.
Okay, and what is the difference that you've seen in your patients that use this type of minimally invasive technique and their recovery afterwards?
Recovery is much easier, there's no doubt about it. Not damaging the muscles is key to getting patients back to their normal range of function. And if you can do that through a minimally invasive technique, utilizing a front or back approach, it really helps them in terms of recovery.
Okay, and is there an age range that this surgery qualifies for?
It works for pretty much any patient, any age. Certainly there are always a few exceptions. Previous, larger surgeries in the front may preclude a front approach, but ultimately most patients can benefit from this kind of technique. And
injuries-wise, I know we talked a little bit about that, but can you kind of expand on, if somebody does receive an injury like that, when would you say, okay, this is the road we need to go down?
I think for most patients, it's, fit the right treatment with the right problem. So if conservative care is a good first-line choice, that's great. Try some physical therapy or an injection or some manipulation. That can be really helpful. But if you've tried those things and are progressing, not very well, you might need a surgery to help you achieve a full recovery.
What have your patients said, after this type of surgery and how excited they are, to get back to their lifestyle?
They're really glad to get back to activities. Like most patients, nobody wants to sign up for spine surgery. There's some apprehension and some concern about, getting through a procedure like that. But I think the most common thing we hear afterwards is, why did I wait so long? So patients are happy and they're getting back to their activities.
How can people get in touch with you?
You can call the office number. I think you have an email as well as a website. All those ways are available to make an appointment.
Perfect. Thank you so much for joining us.
Thank you for having me.
And for more information on the Colorado Springs Orthopaedic Group, you can just go to csog.net.